Well, here we are, chapter 5, beginning of week 3. Can you believe it already? So if you've read ahead, you'll see chapter 5 is a little discombobulating, or what I mean by that is it's a little confusing. So I'm here to try to make it seem a little bit clearer. But I'm going to ask you to have your book in front of you, or your e-book, because I'm going to follow the book, and I'm going to highlight important information in the book, not only in the book, but the slides. So we're going to combine those two for a better learning experience. So please let me know if this was good or not, and we can just keep on doing it. So let's start out with the physical and chemical barriers that protect us from the outside world, so to speak. So intact skin and mucous membranes are the first line of defense. So no cuts, right? You make a little cut, you immediately make an opening into one of our largest systems, our integumentary system. So we don't want any breaks in that system. Not only is the skin important, but because it acts as a protective covering, but also the sweat glands secrete lysosome, an antimicrobial enzyme. Sebaceous glands secrete sebum, which has antimicrobial and antifungal properties. Acidic secretions from the skin and the mucosa of the GI tract also inhibits growth of many pathogenic organisms. Some secretions from the mammary glands and the respiratory and GI tracts contain antibody immunoglobulins. All right, so all of those are important, skin and mucous membranes. So you know, from the head to the toe, from the mouth to the anus, those are all mucous membranes. So there's something all along there that's going to help protect us from invasion of those invaders, those bacteria, microbes. So our second line of defense is the inflammatory response, and that's our body's job, right? We can help the physical, we can stay away from things, we can avoid foods, so we can do some of that work. But the second line of defense is the inflammatory response, so its job is in our body. So it involves two processes, phagocytosis and inflammation. Let me go to the next slide for you. So phagocytosis is the process of enveloping and destroying foreign matter. I usually think of this as like, remember that game, Pac-Man, where it would just go along and gobble up an invader? So that's what I think of as phagocytes. So anyway, the process of enveloping and destroying foreign matter helps to rid the body of invading microorganisms and debris. White blood cells, or leukocytes, are colorless blood cells that have the ability to phagocytose, or ingest, bacteria that can cause infection. So that's important for you to know. So remember, again, phagocytosis is the microbe that undergoes the process of phagocytosis. In other words, it recognizes an invader, it engulfs it, and then it kills it and degrades it, just breaks it down, and then our lymph system can just put it into the blood system, we can get rid of it. And our white blood cells, or our leukocytes, are colorless cells. I know, okay, bear with me if I repeat myself because it's important. I'll repeat it twice, and you can read it once. That's 3 times of learning. So hopefully this process will get into your brain. And anyway, we've got the colorless cells, or the leukocytes, or the white blood cells, and we've got our phagocytes, which ingest the bacteria. And then another thing we have is basophils, and this is in your book, first paragraph on page 57. So basophils initiate the inflammatory response and release histamine. Now histamine, you've probably recognized histamine is something in the inflammatory response. Allergens, you may think of it, you may take an antihistamine to prevent an if you have some sort of allergy, so you'll take an antihistamine, right? But our body actually releases histamine to help fight off any allergens. So another thing that's in your book, a little bit under basophils, is it talks about B lymphocytes produce antibodies and T lymphocytes increase the body's immune response. That's pretty important. And then down a little bit more, it also talks about some reticuloendothelial cells protect the body by digesting and absorbing foreign materials such as old red blood cells, bacteria, and colloidal particles. These cells may also be called macrophages. So there we've got three good words: basophils, histamine, B cells, T cells, and macrophages. All important in this system. So now let's talk about immunity. So immunity provides resistance to invading organisms. It enables the body to fight off invaders once they have gained access. So in your book, it does give you this description. Immunity provides the body with resistance to invading organisms and enables it to fight off invaders once they have gained access. So your body's constantly fighting off things that you may not even realize it's fighting off. So let's go to the word antigen. That's at the top on page 57, top of the paragraph. An antigen is any substance that is capable of stimulating a response from the immune system. That's an antigen, so it's anti. Then we've got another anti, which is antibody. It's also known as immunoglobulins. And they're proteins that are created in response to specific antigens. So we've got an antibody acting against an antigen. The formation and function of antibodies are discussed in the antibody-mediated immunity section of this chapter. So we'll talk about it a little bit more. So if you look on your slide, though, we've got the immunity as a main subject. And then we've got adaptive immunity. Now there's two types of adaptive immunity. There's a natural immunity, and that's where it's passed on from the mom or maternal. And then we've got an active immunity where you get some sort of infection or bacteria and your body develops a natural immunity to that bacteria. Maybe it's a flu. Let's just give you something simple. And then there's also another type called artificial. And this is passive or active. And those would be immunizations or antibody transfer from the mom to the baby. So those are artificial. And then you've got an innate immunity, which it means it's just naturally in your body. We're going to talk about that. But in your book, I want to pull you into your book. So it talks about innate immunity is present in the body at birth. So that's important to know, that we're born with innate immunity. I'm going to talk about this again a little bit later. I'll make sure that you realize the difference between something just being born against, because it's only going to last for a little while. So you know how they say if you breastfeed, you can help give immunities to your baby. Well, that's going to be short-lived. Physical and chemical barriers to infection, like phagocytosis. So that's your innate immunity. And active acquired immunity is developed after direct contact with antigen through illness or vaccination. So I hope that makes that slide a little bit clearer, but it is all in your book. So let's move to the organs of the immune system. And this too is in your book on page 58. And there's a really good picture also here. So you've got the organs like the thymus. Now the thymus is located like in the chest bone area, the sternum area. And that helps protect us against immunity till about teenage years. We've got the tonsils, and we know sometimes when we get a cold or infection that our tonsils will swell. We can do without our tonsils. That's why people have them out. So that's not a problem because there's something else on down the line that can help fight infection. But we do have a lot of lymph nodes throughout the body. We have gut-associated lymphoid tissue, which helps fight off bacteria. Our liver, our liver is so important. So it has globulins in it, globulins that help fight off infection. So I hope you take some notes because when I emphasize words, it's for a reason. So globulins in the liver help us fight off infection. Also our bone marrow, that's where our white blood cells are made, so our bone marrow is important. In this picture, it doesn't say it on the slide, but it's in the picture. Oh yes, it does under thymus, sorry. I'm looking at the book and the slide and the book and the slide, so hope you do the same thing. Between my voice, the slide, and the book, I'm sure you'll get this. All right, so let's talk about some non-specific defenses against infection. So your innate immunity, it's present at birth, physical and chemical barriers to the invasion of the body, as well as substances that protect and repair tissues and stimulate the body to fight off disease. Also, we've got physical and chemical barriers, inflammation, and phagocytosis that are non-specific defenses against infection. Non-specific. So it means that they're used all the time. They don't have a specificity towards an infection or towards a specific antibody. You'll see in the slide it also talks about adaptive immunity, and active immunity is a natural immunity that we have, or an artificial immunity as in injections. Passive immunity means it's just passed on to you. Now the complement system, that is on page 58 under non-specific defenses against infection. I think the reason this got a whole slide to itself is because it's important. It's especially important in immunologically mediated reactions involving antigen-antibody responses. So let me just look at the book for a minute. So it talks about other non-specific defenses against infection that protect the body include complement, pyrogen, and interferon. Complement is a series of proteins that enhance the inflammatory process in the immune response. Chemotaxis, phagocytosis, and the activity of antibodies are stimulated by complement. So it's a series of proteins that help fight off our antigen antibody. All right, let's talk about the inflammatory process itself. Before I go into that, I just want to, in your book, pull you into the specific responses against infection. We talked about non-specific, but let's talk about specific. So those are antibody-mediated or humoral immunities. They're immediate and the first line of defense. So we talked about first line of defense, and that's part of this defense. But on the top of page 59, like the first paragraph is important. So antibodies or immunoglobulins, IgG or IG, are divided into 5 classes. And this is important. So IgG, won't say much about that. IgM, IgA, IgE, and IgI. In your book, it talks about IgG is the most abundant immunoglobulin. It crosses the placenta to provide passive immunity for the newborn. Now, I know I talked about that passive immunity that the mother passes on to the baby, but this one goes through the placenta. So it makes it a little bit different. If you can just remember, the IgG is passed from the placenta of the mom to the baby. The other one, we're born with an immunity to certain things just by being born, the virtue of being born. But this one is placenta oriented. All right, sorry, I digress. So let's go to the inflammatory process. So it's a series of cellular changes that signal the body's response to injury or infection. So it's like something invades our body. So a lot of changes, a series of things begin to occur. So it can be caused by three things: physical agents, chemical agents, or biologic agents. So the word inflammation literally means the fire within. This descriptive phase illustrates the 5 signs that indicate local inflammation. Now this is pretty important, and it's going to come up time and time again, inflammation. So I really want you to commit this to memory. And that's, I'm giving you 2 ways here to remember it. It's in your book, but I put it on the slide too. So rubor, or redness. So when you hurt yourself, it gets red. It's rubor. It might get hot, calor. It might swell up, tumor. You might have pain from that swelling and heat, which is dolor. And a loss of function. That doesn't have an or, sorry, but again, rubor, calor, tumor, dolor, or loss of function. So those are really important to remember. And those are on page 59. So let's go to those 5 cardinal signs of inflammation. The pain, the heat, the pain, dolor, the heat, calor, the redness, rubor, the swelling, tumor. And we know tumor is like something that gets big, right? So that kind of helps you remember swelling. And then that loss of function. And that loss of function could be secondary to all those other things, because you can't move it because it hurts. You can't move it because it's red and swollen. So some actions in the inflammatory process. So I'm on page 59 here. So you get some cardiovascular changes. That's the first action of the inflammatory process. Changes in blood vessel diameter. So your blood vessels may dilate or get bigger, and that's what puts them closer to the surface, and that's why you feel the heat. Also, the body initially responds to an injury or infection with dilation of the capillary beds, as I said. The dilation brings increased blood flow to the area. The increase in blood flow is responsible for the characteristic warmth and redness at the site of inflammation. Okay, you heard it a few times. Increased capillary permeability. What does that mean? Well, in your book, under increased capillary or increased permeability, it's after the increased blood flow brings leukocytes to the area. These chemical mediators cause leukocytes, or the white cells, to line the small blood vessel walls near the site of inflammation. This process is called pavementing. So it lines up they just line up like a pavement. I'm going to show you in the next picture. Gradually, these cells pass through the vessel walls and inhabit the inflamed area. These cells, largely neutrophils and monocytes, are drawn to the site of injury or infection. And then it may form some fluid, and this collection of fluid is responsible for the swelling that's noted from the inflammation site. And that could be from the capillaries leaking fluid into the tissue. So that's the increased capillary permeability. They get a little leaky because of the trauma or injury or the actual process itself. So chemical mediators. So the hemodynamic changes and vascular permeability, those two things I just talked about, occur with the help of several chemical mediators. So see, here's one thing, you guys. Our body is amazing. It's so amazing the way that it reacts to something right away. We don't even know this is happening inside of us. So the chemical mediators are called prostaglandins, histamine, and leukotrienes. So cytokinins and eicosanoids, these kinins or kinins produce blood vessel dilation and permeability. So that's under your increased permeability section, which is the swelling. Because the capillaries leak the fluid, there's swelling. Again, if I repeat myself, just bear with me because it's just going to hopefully make things a little clearer. So that kinine system I was talking about, bradykinin, it mediates blood vessel dilation and permeability. So specifically, it also produces pain, another classic sign of inflammation, this kinine system. The bradykinin, leukotrienes, cytokinin. And those were our chemical mediators. So now let's go down to anti-inflammation. So cortisol. So cortisone. What else might you know it by? Cortisol, cortisone. Cortisone is probably the medication you're familiar with, but our body makes cortisol. It's a hormone produced by the adrenal cortex. It's an anti-inflammatory substance that slows the release of histamine. So if you can think of this conversely then, if I give cortisone, it might help the release of histamine. It's going to be a major medication on down the line with inflammations. Cortisol also stabilizes lysosomal membranes and prevents the influx of leukocytes, which are those white blood cells. Result is to impede the inflammatory process. It protects the body from excessive or prolonged inflammation. So again, think back to cortisone. If you're familiar with anybody that takes cortisone, maybe you know, maybe your parents do. And it protects the body from that prolonged inflammation. You may inhale cortisone. It prevents your lungs from being inflamed. We're going to talk a lot about cortisol in this MedSurg 1, because we will take it orally, plus our body makes it ourselves. Drugs such as corticosteroids, that's another word. That's what I was trying to think of. Steroids. It's a cortisone. Corticosteroids. Cortisol, corticol, that mimic cortisol, often used to treat inflammatory conditions. So corticosteroids mimic the cortisol that we make and often are used to treat inflammation or inflammatory conditions. So what are some signs and symptoms of inflammation? So you can turn to page 60. And I want to call your attention to that picture there, the inflammatory response to tissue injury. And you can actually see kind of the pavementing up at the top. See how those cells just line up to protect? All right, so you can take a peek at that picture. So again, let's go back to signs and symptoms of inflammation. So local inflammation produces those classic signs we talked about a minute ago: heat, swelling, redness, and pain, all of which result in loss of function. You hurt yourself, it hurts so bad you can't even use it. Then there's systemic inflammation, where it's not local anymore, it's spread to the whole body, the whole system. And some of those signs will be a fever. It may be 101 or higher. I know in the COVID situation, they're looking for not even that high of a fever, because it doesn't always go that high. I may be throwing COVID in several times during this lecture because it kind of fits in. It also goes into other lectures, but also, let's go back. Headache, another sign of COVID, by the way. Muscle aches, chills, sweating, another sign, COVID. And leukocytosis, or that elevation of white blood cells. So if the doctor drew some blood, he would be looking for elevation of white blood cells in your CBC. Because in your CBC is going to be your WBC, your hemoglobin hematocrit. If you order a differential, there'll be a breakdown of those cells. But the WBC is what's going to tell him if it's higher than 10,000, because normal would be 5 to 10,000. So if it's going to be higher than that, it's going to say, oh, they've got a big infection systemically. So now we've got an infection, but now let's heal. All right? So wound healing. So the age and general health of the person affect how rapidly the regeneration and repair process occurs. So if we think back to our elderly, they heal a little slower, don't they? The healing process can be delayed, as I said, in the older adult as a result of decreased tissue elasticity and decreased blood supply. Also, diet has a lot to do with that. Tissue repair and regeneration set in motion from the beginning of the inflammatory process. So the minute we get hurt, our body kicks in and starts to fix it. The process speed depends on type of injury injured. Is it major or minor? Like the severity of the wound. The presence of infection, maybe it's just an injury, and so our body reacts to just the injury with our signs of infection or inflammation. But if there's an infection, it's going to send all of those cells to help fight that off. And also the health of the host. How healthy are you? That's why it's so important for you guys to take care of yourself, eat well, and be healthy so that you can fight off infection. And we do know that stress can lead to poor healing, poor getting over illness. So we don't want to give that to our patients either. We don't want to have our patients stressed out. Now, this is another thing. As I lecture, I'm going to be throwing in things that we need to do for our patients, or be careful that we don't do to our patients. So if we know stress will increase the cortisol level in our bodies, and you may not have seen this in your book yet, but I'm giving you information so that you'll understand. Okay, so if we have a stress occur in our body, it may lower our immune system. Our cortisol level is going to try to rise up and fight that off. So it's important that we don't allow our patients to feel stress. The stress of being ill is bad enough, right? But the stress of being in a hospital bed or confined into a situation that we can't help ourselves because of an injury or an illness, it's devastating. And it can make our wound heal slower. And what if it's a cancer surgery and we're trying to heal from that? We've got the devastation of a cancer healing. And now we have to try to heal. Our body does. Our body does its job, but our mind has a lot to do with healing. So I digressed again, didn't I? Okay, let's go to infection. So what is infection? It's on page 61. And there's a good picture there of phagocytosis on page 61. You can kind of see the way it works and how it just engulfs something, engulfs a bacteria. So what is infection? It's an invasion by a microorganism, multiplication of invading organisms, and resulting tissue damage. So it invades, it multiplies, and then you get a damage. Inflammation is a nonspecific body reaction to tissue injury, infection, a specific process that causes tissue injury, inflammation. Inflammation precedes infection. So you can get an inflammation of a wound, right? And you get your rubor, dolor, calor, tumor, right? But it doesn't mean it's infected. It just means you got something going on. You hurt yourself and now you've got an inflammation. So infection usually the result of invasion of organisms. So it's an opening of our protective skin. And we've allowed bacteria to get in. That's why it's always important to clean a wound, take care of a wound, so that we want to prevent any bacteria from coming in. And it can be caused by a wide variety of organisms. So what are some of those organisms? Well, let me tell you. So this is under infectious organisms, page 61 to 62. A lot more on page 62. So bacteria is one. Staph is on our skin. If we don't clean our skin, you can let staph in. That could be a poem, it sounds like. Viruses can be an infectious agent. Fungi, and I wrote in here molds or cryptococcus. So those are types of fungi. Fungi is like, I think of it as a mushroom. It's a mold or a cryptococcus. Then there's a protozoa. It has little wings that helps it move along. Rickettsia, now that's not to be confused with rickets, the disease. Rickettsia is an infection. Helminths. Helminths are worms. You can see the picture, it's a worm. They can be parasitic worms. Sometimes worms are in food and we ingest a parasitic worm. One time I had a patient who was having gallbladder signs and symptoms, and they did a HIDA scan where they took a peek, or also that's where you look at the function of the gallbladder as a HIDA scan. But if you just did a gallbladder ultrasound, they saw something in there. And it was a 6-foot worm in the gallbladder. That was causing her gallbladder symptoms. It wasn't a stone. And you see, she had been somewhere. She had traveled. That's why we always ask our patients, have you traveled? And that's why a lot of times you'll go to a doctor's office and they'll say, have you traveled recently? Because there's so many infectious agents we can get when we travel. Worms is one of them. Anyway, she had her gallbladder out, worm came out, and the patient got well. I'll tell you another little story here before I move on, sorry. But this is another example of worms, how they can invade our body. So, you know, North Korea, South Korea. North Korea North Korea people are made to cook their own and make their own food, grow their own food. Well, the only really way that they can grow their food and make it grow well is they urinate and poop, sorry to say, as fertilizer to help their crops to grow. Well, what if they have a worm? That worm can get in the food they eat. So the story is that someone was defecting from North Korea to South Korea, and he went across the demilitarized zone, and that's the zone that's supposed to be safe, not supposed to shoot anybody in that zone. But this person was trying to run from North Korea to South Korea, and the North Koreans shot him in the back. But our people, our good military, ran and got him out of the demilitarized zone, took him to South Korea, and did surgery on him to remove this bullet. Well, the minute they opened him up, worms fell out because he had been ingesting worms in the food. So again, you can ingest a worm. But another way you can get a worm is called a hookworm. And this is in your book on page 63. Hookworms often enter an individual through the soles of the feet and migrate throughout the body, including to the heart and the lungs. So that's a hookworm. So children that run barefoot in the dirt can get a hookworm. Do they always know? No. Don't be paranoid now. But you got to know that that is a possibility. Most people infected have no symptoms. Let's read on because that'll make you feel better. Most people infected have no symptoms. However, infected children are often physically, nutritionally, and cognitively impaired. Some have respiratory symptoms during the migration of the hookworm through the lungs. Others have GI symptoms and anemia caused by blood loss when the hookworm attaches to the intestinal wall. So see, I'm not making this stuff up. It's in your book. Right, prions. So prions are an interesting thing. They kind of remind me of like a, what do you call it? Like, not like a spider, but it has a body and then it's got arms that just hook on. It's a prion, it pries on. Let's put it that way. That's a good word, it pries on. You can remember that, prion. So one thing that we know of and have heard of is mad cow disease. In your book, it also mentions Creutzfeldt-Jacobs disease, which is a form of mad cow disease. Now, I did have a patient that had that. You really don't know you have mad cow disease or Creutzfeldt-Jacobs disease until they can do a biopsy of the brain, which is usually after someone has expired. Had a patient that had this Creutzfeldt-Jacobs disease. He was only in his 50s, and he owned a supermarket, owned many supermarkets. In fact, he managed a Save Marts. And so he had a very high position, very smart man in his 50s, and he started doing weird things. He started parking weird, opposite the way he was supposed to. He started, he'd go to the bank and withdraw the same amount of money every single day. Unusual behavior for him. One day he showed up at his mom's to have lunch, and it was 4 in the morning. So they knew something was wrong. They couldn't really diagnose it. They had to diagnose it by process of elimination, which is sometimes how we have to do that kind of thing. He was very confused, combative. We had to use restraints. The only thing that calmed him down really was music. So remember that sometimes music can calm people down. Some of our patients, not patients, but our students would sing to him, and that would calm him down also. He did end up passing, but it can be a bad situation. Sorry, I had to take a drink. Another disease or infectious agent is mycoplasma, and we usually see that in AIDS types patients, so it's in immunocompromised people. At some point we'll be talking about AIDS patients, and we'll talk about mycoplasma. So it is an infection agent in an immunocompromised situation. Okay, now let's talk about this, transmission of infection, page 63. So there's a chain of infection. There's a chain. So it starts with a causative agent, whatever that agent is. It's a microorganism, bacteria, virus, protozoa, or something else that is present in sufficient number and virulence to damage human tissue. Then there's a reservoir. That's where it reproduces. So you can remember reservoir, reproduce, R-E, they both start with re. That's where the bacteria or the infective agent reproduces. And then there's the portal of exit. And that portal of exit, I used an example of nose and mouth. So coughing can be a portal of exit. I suppose it could be rectal as well. Mode of transfer, so that's called a common vehicle. And you'll see in your book on page 63 under mode of transfer, it talks about common vehicle transmission. That occurs when water, food, blood, or air currents contaminate with a pathogen and are shared by many people. Now I can give you an example here. Let's say your potato salad that you took to the picnic. Well, that can be a mode of transfer. It's a food that everybody digs into and enjoys at the moment, but could suffer later. Then there's something called a vector transmission. And a vector transmission is important to know, as is the common vehicle, by the way, important to know. So the vector transmission occurs when microorganisms are transported into a host by a living organism, such as a fly or a mosquito. So vector is a fly or mosquito that's transferring this infection. So the portal of entry, little confusing because we have portal of exit, something exits there, right? And portal of entry is where it enters the host. So those, of course, would be influenza and cold viruses often enter the body through the mucous membranes of the nose and mouth. So you can see it's an exit and an entrance. GI tract, urethra, open wounds, IV access devices, urinary catheters, and drains can be portals of entry for bacteria. We'll be talking about that a lot because anytime there's something going into the body, into the patient, it can be a portal of entry for bacteria. So we also need a susceptible host. And that depends on genetic or constitutional factors, specific immunity, and nonspecific factors that affect an individual's ability to resist infection. In your book, populations adequately immunized against rubella, for example, are not susceptible to measles. Similarly, individuals who have had chickenpox have developed immunity to the virus and do not become ill if exposed a second time. So, are you susceptible? Okay. So some signs and symptoms of infection. So this is page 63, 64. So in many instances, a period of subclinical infection or an incubation period occurs during which few, if any, symptoms are present. During this period, symptomatic persons may be more contagious than those who are exhibiting symptoms. COVID. This is especially the case with people infected with such viruses as measles and many cold viruses. All right, so that's important to know. And then, so local infections are exactly what that says. It's localized. It's just in the area. right? But generalized infection could mean that it goes through the whole body. Patients with generalized infections may not show all the signs that are apparent with localized infections. Redness, for example, may not be visible. Pain may be moderate to severe, depending on the location of the symptoms. Because it's internal. What if it's internal? You might not know an organ. Appendix. You could get you get a fever from an appendix infection, inflammation. So you can read that part of the book on page 64, the difference between local infections and general infections. You think you get a fever with a generalized infection? Yep, you would. So what are some types of infections? Now this is really important to know about these guys. So community-acquired infection. Community-acquired infections are acquired in day-to-day contact with the public. COVID. And, you know, let's think about it. So we need to wash our hands all the time, right? We need to use antibacterial. I'd get right into the use of doing it all the time. You've got to keep your risk at a minimum of getting anything. You don't know what other people do. They might not wash their hands after the bathroom. So, or a railing, going up the steps, holding onto a railing. Be careful. You could get something. Pneumonia even, if they've coughed into their hand and then they've touched the railing, you don't know, you can't see it. So, community-acquired infection. Many viral infections are pervasive in society and occur at predictable times of the year. Okay, we have flu season, we have childhood illnesses are common in September when children take to school all of the new viruses in which they were exposed during the summer. So, sharing of microorganisms. Poverty, low immunization rates, overcrowding, insanitary living conditions, and resistant strains of pathogens are at least partially responsible for the increase in infectious diseases that were once well controlled. The resurgence of TB is an example. So these are all infections we get from the community, other people. Another important thing to remember is about foodborne illnesses. It's a common community-acquired infection, infectious disease. It's more common in the summer, where you get food poisoning from Staphylococcus or Salmonella. Periodic outbreaks in hepatitis A are possible at any time of the year and the result of poor hygiene by food handlers. We also, as we send our family loved ones to college, they always have to get an immunization against hepatitis. So, important to remember. It's interesting too, on page 65, there's a list of, this is box 5.1, there's a list of the CDC's nationally notifiable infectious diseases. What that means is that when one of these diseases that are listed here appear in a doctor's office, the doctor's office has to notify the CDC because they keep track of all of these diseases to see, are they popping up somewhere? Are we beginning to get an outbreak? Is there a community or an area that has a high incidence of these certain diseases? Rubella is a common one. Lyme disease, I'm sure you've heard of that. Salmonellosis, those are reportable though, but also we get them in the community. All right, sorry. Now, healthcare associated infections. So that's important to know. So HAIs, as they're abbreviated, healthcare associated infections, HAI, were previously called nosocomial infections because of the patient breathing through the nose getting them. But HAIs are an important cause of increased morbidity, prolonged hospitalization, and higher healthcare costs. These infections occur within a healthcare facility and may affect both the patient and the healthcare worker. So this is on page 66 if you're following with me in the book. So what are some HAIs that our patients can get? Well, HAIs such as catheter-associated urinary tract infections could be one. Vancomycin-resistant enterococcus, or VRE, it's another infection that's passed in a facility from person to person. VRE, vanco-resistant enterococcus, it's another infection that's passed on from patient to patient because of the healthcare worker not washing their hands. Also, another thing that can happen is if a patient has a decubitus, anytime you've got something from the outside to the inside, an IV catheter, a Foley catheter, any kind of tube, chest tube, outside to the inside, and you're in a facility, you're at risk for getting a healthcare associated infection. Also, if you have an open wound, like a decubitus, that can make you at risk for a healthcare associated infection. So know the difference between community acquired, it could be like a pneumonia, healthcare associated could be a decubitus infection, or a VRE catheter infection, UTI from a Foley. So those are really important for us to know about and prevent, right? Let's try a question. So the inflammatory process involves 4 changes or factors: hemodynamic changes, increased permeability of membranes, chemical mediators, and what? I'll give you a minute to think about it. So the answer is A, hormonal factors. So why is it endocrine? Why isn't it endocrine? Well, we talked about the cortex, adrenal cortex, secreting cortisone, so it's not endocrine changes, constriction of the capillary bed, it's more dilation, and decreased release of histamine. Well, there's an increase of histamine in an inflammatory process. Question number 2. Blank are one-celled microorganisms capable of multiplying rapidly within a susceptible host. They are classified by shape, cluster pattern, whether they need oxygen. By the way, that is aerobic versus anaerobic, with or without oxygen, and their ability to take up and retain stains. Minute. So the correct answer is bacteria. So this is the definition of bacteria. Okay. So medical asepsis. So I do believe that's on page 67. Starts on the bottom of page 67. Can I go back for 1 second? I want to be sure and cover everything. So I talked about those healthcare acquired infections. We talked about VRE. We talked about, what else did we talk about? I want to talk about multi-drug resistant organisms, or MDROs. This is in your book on page 67. Just don't want to miss anything, so sometimes I do have to go back, sorry. Also, examples include meth-resistant staph, which is MRSA. I'm sure you've heard of that one. The VRE, E. coli, and Klebsiella. So a word I want to use here under HAI, I'm sorry I almost missed it, but I'm not going to now. So iatrogenic infection. What is an iatrogenic infection? It's caused by the treatment given the patient. For instance, let's say you get an antibiotic. Well, you end up with a yeast infection. And that's an iatrogenic because it was given, you got it because of something you were given as a treatment. So iatrogenic, important to remember that word. Another form of iatrogenic infection can be caused by the treatment of a primary infection, the overgrowth of a second microorganism that can also cause illness. The term for this process is superinfection. So that's on page 67, the second paragraph, superinfection. So it's the overgrowth of a second microorganism that can cause illness. It's especially common with treatment using broad-spectrum antimicrobials. The organism Clostridium difficile, C. diff, resides in the GI tract of many individuals. It is kept in check by the normal bacterial flora of the GI tract. Broad-spectrum antibiotics or antimicrobials can kill enough of the normal flora to allow C. diff to grow out of control, producing severe colitis and diarrhea. So I'm sure you've heard of that, patients getting C. diff. It's usually caused from something else, or it was passed on to them from someone else, not being careful. It was acquired, though, in a facility or in a hospital. It's not something that they would normally have. So let's move on to the medical asepsis on the bottom, page 67. So it limits the spread of microorganisms. It's often called clean technique and hand washing. So hand washing is the most effective method to prevent cross-contamination. I put that in red because it's really important. So what 3 things should be used for good hand washing? The use of antimicrobial soap is recommended when working with patients who are more susceptible to infection, such as premature infants or immunocompromised patients. Very important to remember. Also, on page 68, it has a nice little graph there, not graph, but has notes on nursing considerations related to CDC recommendations to prevent antimicrobial resistance in healthcare settings. So remember, healthcare, community acquired. And then how important hand washing is. In fact, I'm going to jump for a second go to page 70, and you're going to see we got a whole page full of how to hand rub or hand wash. Shows you how to do that. And you should wash your hands before and after you put on gloves too, because gloves aren't perfect. They can rip and tear. So this is something that's very important. It's the most basic and effective way to prevent cross-contamination. Okay. So surgical asepsis or sterile technique, it eliminates microorganisms from any object that comes into contact with the patient. It includes care techniques that prevent non-sterile surfaces from coming into contact with the patient, such as during dressing changes. Now, you guys, no one's watching you. When you're doing a sterile dressing change or when you're putting in a Foley, you might not have anybody there. But don't accidentally touch something and think, well, nobody saw it, so it doesn't matter. Because it does matter. It does matter to the patient who's then being exposed to maybe a bacteria. So please be careful when you do sterile dressing changes or anything that's done sterile, like putting in a Foley. All right. Standard precautions, page 69. So standard precautions are guidelines for infection control. Infection control guidelines for hospitals and other healthcare agencies from the Hospital Infection Control Practices Advisory Committee and the CDC. For all patients in hospitals, regardless of their isolation status, so it goes across the board to everybody. Use when you will have contact with a patient's blood, bodily fluids, secretions, excretions, broken skin, and mucous membranes. Use when you are having contact with materials that are soiled or contaminated with body fluids of blood. So don't just grab a bunch of sheets and pull them next to your scrubs. Be sure you keep them away from you. Wash your hands before and after gloving. I mentioned that before, it must be pretty important. And I do lead you to figure 5.4, which was the hand washing figure, and also to box 5.3, which is guidelines for use of standard precautions. So those are really important to remember. All right, so transmission-based or isolation precautions. So what are the different types of precautions that we see? Airborne precautions, standard precautions. Standard precautions we need to take just across the board. That's baseline standard precautions. Contact precautions, droplet precautions, and airborne precautions. If you forget, you know, what is what, there's always a book at the nurse's station. Your facility should have some sort of a book that how they determine what is a contact precaution, a droplet precaution. What do you need? What kind of gear or equipment do you need to prevent infection from getting to that patient or prevent you from getting their infection? So those would be isolations. I won't go through all the different precautions. You can read through those. But know that there's airborne droplet contact precautions, and you need to abide by each one of those rules that your facility has. There's also surgical masks that filter expired air, respirators such as HEPA filter respirators and N95 respirators. That's a COVID thing that filters inspired air. Droplets are spread primarily during coughing or sneezing or talking and during certain procedures such as suctioning and bronchoscopy. Needles, dressings, stethoscopes, bed rails, and doorknobs may become contaminated and cause the spread of microorganisms by contact. Okay, let's move on to our protective environment, or PE. A protective environment, this is on page 73, is needed to reduce the fungal spore count in the air and to reduce the risk of invasive environment fungal infections for vulnerable patients. Now, air conditioning vents, they require humidity, which I'm telling you, some infections, especially spores, grow in moist areas. So if you were a home health nurse, you would want to make sure that the home health facility that the home that you're going to, they change their filters regularly. There was a Legionnaire's disease, if you've heard of that, and that was spread because it was spread through the air conditioning vents. And that's kind of how we first became aware of this. It happened quite a long time ago. You probably weren't even born, but I remember it because it happened in the VA. That's where it started. That's why it was called Legionnaire's, because it was in the VA. But protective environment, or PE, is needed to reduce the fungal spore count in the air and to reduce the risk of fungal infections for vulnerable patients. So it's important if it's at a facility, you don't have much control over that, but if it's at home health, you would. Also, some other protective environment situations would be directed room airflow, positive pressure rooms, sealed rooms, and surfaces should be easy to clean. So in that room, all the surfaces should be easy to clean, and they should be cleaned with the correct cleaner. Bioterrorism. So this is something that we all kind of fear right now, unfortunately. It's the intentional use of microorganisms to cause death or disease. Methods used to spread agents of bioterrorism are varied and might include powder, aerosol, or contamination of food or water. So what do you do about it? I mean, seriously, what do you do? Well, nurses should be aware of their employees' agency's plans for dealing with public exposure to bioterrorism agents. Now, every facility, every hospital has to have a bioterrorism unit or a bioterrorism group of people who know what to do first and try to help everybody else. But you need to know that what your facility's policy is. Decontamination procedures, personal protective equipment, and procedures. It's too bad we have to worry about that now. Immunocompromised patients. So these are patients receiving chemotherapy and other patients with low white blood cell counts are at increased risk of infection. The use of standard precautions for all patients and of transmission-based precautions for specific situations should reduce the risk of acquired infections from other persons and from the environment. So, immunocompromised patient, as I said, chemotherapy, maybe their white blood cell count is low, maybe they have leukemia or another lymphoma. Decreased immunity to infection, they're at risk for bacterial, fungal, parasitic, and viral infections. What you or I might not react to or be infected by, immunocompromised patients are susceptible because of their low white blood count. They don't have those white blood cells that fight off infection. It's too low. Or sometimes, like in leukemia, they have some, but they're not good enough. They're immature. Another instance is aplastic anemia. So that is in your book on page 74. Nursing care of patients with an infection. So fluid intake is important in the transportation of nutrients to the cells to fight infection. It's good for our kidneys as well. How much fluid intake should a patient have each day? Well, it depends. What if you are fluid restricted, if you have kidney disease or heart disease, but you do need some fluids? Examples of nursing diagnosis for patients with infections. If you have an infection, you do need more fluids. Because, you are at risk for infection, you're at risk for injury, impaired tissue integrity. What if you're sweating a lot, you have a fever, you're losing fluids that way? So urge the patient to consume adequate fluids And one way to tell is a person getting enough. Keep an eye on O. What goes in must come out. Encourage to consume high protein, high vitamin diet, and especially vitamin C helps patients to fight off infections and to heal. Isolation if it's required. Lab tests can help monitor if you're able to fight the infection. If your white blood count is going down, it means maybe it's working, that you're fighting off the infection. Administer, there's other lab tests too that can tell the doctor if an infection is going away. Administer antibiotic drug therapy. And one thing you need to always tell your patients and your loved ones and yourself, never stop the antibiotics. Even if you're feeling better, you have to continue the antibiotics. You have to continue the course of antibiotics. We'll be talking about that several times in different chapters, how important it is to continue antibiotic therapy, not to stop, even if you're feeling better. Also, hyperbaric oxygen therapy is a good way to fight off infection or to help healing. So there's a patient teaching box on hyperbaric oxygen therapy that you can read through that gives you some information. Remember, in this book, it's important to look at patient teachings, boxes, tables. It all helps, and sometimes answers are there. I'll try to guide you to ones that are important, but I want you to have knowledge. Knowledge is power, so we want to learn as much as we can. All right. So specific defenses against infection, the immune response. So I have page 58 and 59 because that's where we initially talked about it, because we talked about what are the 5 classes of antibodies, and those are IgG, IgM, IgA, IgE, IgD, and IgG, which is the most abundant, and again, I'll say it crosses the placental barrier. What 3 types of cells do T cells include? Helper cells, suppressor cells, killer cells. In AIDS, T cells are diminished. Killer cells destroy antigens. We did talk about cell-mediated immunity. So here's immunodeficiency, a little bit more. Cause and risk factors of immunodeficiency. Causes and risk factors in your book, starting on page 75 to 76. So cause and risk factors, medical treatments like steroids. So if you're on a steroid, it can be a good thing for an infection or an inflammation, but it can also, especially if you're on high doses, make you susceptible to infections, can immunosuppress you. Now, if you are immunosuppressed, as far as nursing care is concerned, you have to be careful, and it's in your book under nursing care of the immunosuppressed patient. Flowers or plants may be prohibited because they provide a reservoir for bacterial growth. This is on page 77, by the way. Fresh produce may be eliminated from the diet if the white blood cell count is too low. Disposable equipment is preferred. So, hypersensitivity and allergies. Just a couple more slides, folks. Hang in there. So, medical treatment, allergy shots, and antihistamines. So, if you have a hypersensitive or an sensitivity or an allergy to something, you can get allergy shots. Hypersensitivity, there is a hypersensitive syndrome where you're sensitive to everything. But let's just say that you're sensitive or you have an allergy to something. you find out, you go to the doctor's office, you get a test where you get multiple exposures to different allergens, and you find out you're allergic to something specific. You can start allergy shots. If they give you allergy shots, they'll start small. So the allergic response, this is under hypersensitivity and allergy on page 77. It says the allergic response begins with sensitization, which means you're going to get a little bit of that thing that you're allergic to. They start out very small, and they get you desensitized to it. The first encounter with a specific allergen results in only a small amount of antibody production. With subsequent exposure, however, the body steps up its defenses by producing large amounts of antibodies which circulate in the bloodstream and travel to the affected tissues. So you can get allergy shots. You can also take antihistamines. One thing I want to talk about antihistamines under medical treatment. It talks about antihistamines sometimes cause confusion in older patients. So on page 77 under the table 5.4. I also want to talk about that table 5.4. So in there it talks about asthma. So that's an allergic reaction, asthma. Let's say, you're exposed to something. So I'm going to give you an example. A teacher, maybe dusting. It doesn't have to be a teacher. Maybe it's your mom. Dusting, and you're allergic to something in the dust. But because of that high rate of allergen in the area, in the air, you may have an asthma attack. And asthma is one of the #1 things that students or children are affected by something that will give them asthma. All right, so in here it mentions pollens, dust, molds, cigarette smoke or pollutants, animal dander. So some people are allergic to dander of cats or dogs. Also under medical treatment it talks about, I'll just read this, long-term medical treatment of allergies involves testing to determine specific allergens. Testing is performed by injecting small amounts of allergen under the skin intradermally or by pricking the surface of the patient's skin and monitoring for the degree of wheal, which is the round, like when you do a TB test, you make a wheal by injecting intradermally, right? And you might get a reaction. After the specific agents have been identified, the patient may be desensitized by injections of tiny quantities of the allergen with one dose gradually increased over a long period of time. Okay, remember antihistamines. Let's say, now it's over the counter, right, an antihistamine, Benadryl, something like that. Maybe one of your patient's family members want to bring in to the hospital the medication that she gives her dad at home. But be careful. Antihistamines can cause confusion in older patients. I know I said it once, but I'm saying it again. For asthma sufferers, bronchodilators, corticosteroids, or both may be prescribed to improve air movement and decrease inflammation of the lungs. Notice I said corticosteroids, cortico, which is anti-inflammation. Right. Oh, now we might have an anaphylactic reaction. The best care is to prevent anaphylaxis whenever possible by obtaining a history of allergies of your patient and taking precautions to protect the patient from substances or drugs that may trigger the reaction. You know what the #1 medication that causes a reaction or an allergic reaction? Penicillin. That's right. So if you give a patient something new, a new medication, you want to keep an eye on them for about 30 minutes to be sure they don't have an allergic reaction. If there is an allergic or anaphylactic reaction, an anaphylactic reaction is major. It can be life-altering. It can be deadly. I mean, we've heard of people having peanut reactions, right? So you have to be careful what you eat if you do have a peanut allergy. I know of a story where a little girl ate some Rice Krispie treats. She didn't know that they put peanut butter in the Rice Krispie treat. Made it yummy, but she had a reaction to peanuts. But she had an EpiPen, which is epinephrine pen, which helped her. Unfortunately, she did pass away. That's that story, but we don't want to talk about that. So notice medical treatment. Oxygen's number one. Always supply oxygen because we got to talk Maslow. We have to talk our ABCs. Oxygen is the number one thing that we've got to be sure to give our patient in an anaphylactic situation. But what if their airway closes off? Well, that's when we might use epinephrine to open the airway, to counteract that allergy or anaphylactic reaction. And then, so if you're looking at your book on page 78, we're talking about the medical treatment. Oxygen is given in addition to intravenous epinephrine. Nursing care of the patient would be in the event of an allergic reaction. Nursing interventions are aimed at minimizing the patient's anxiety, and once medical care initiated, administer prescribed drugs, including oxygen, and monitoring IV fluids. They might need IV fluids because a lot of times they get vasoconstricted, which is what constricts their airway, and so fluids will help open up the blood vessels and hopefully counteract some of the allergic reaction. Monitor respirations, the patient's color, heart rate, oxygen saturation, and be sure the patient is fully recovered. That would be our nursing care. Okay, one more, hang in there. Autoimmune diseases. So the exact cause and pathology of most autoimmune diseases are poorly understood, but many of these disorders cause severe illness and death. So some examples of autoimmune diseases would be multiple sclerosis, rheumatoid arthritis, diabetes type 1, lupus, erythematosus. So autoimmune means you're allergic, you're reacting to yourself. Auto, yourself, immune, you're immune to something within yourself. So these are diseases that your body reacts to itself and then causes a disease. So this is in your book under autoimmune diseases. Genetic factors can be a factor, can be involved in autoimmune diseases. Autoimmune diseases cause injury in 3 ways: the effect of antibodies on cell surfaces, through the deposit of antigen-antibody complexes, especially in capillaries, joints, and renal tissue, and through the action of sensitized T cells. All right, so there is a list of autoimmune disorders and their targets, table 5.5. I would have you take a look at that. That is just for your information. We're going to be talking about more autoimmune diseases, but it happened to fit in this chapter, so and it's in your book, so we need to talk about it, right? Medical treatment. Medical interventions vary depending on the specific autoimmune diseases. In general, corticosteroids and non-steroidal anti-inflammatories are used to treat inflammation. In immunosuppressive therapies, maybe try to moderate the autoimmune response. Nursing care, you want to give the patient adequate rest, maintenance of optimal hydration and nutritional status, and prevent infection. Those are all very important. Okay, thank you.